Hello, my name is Dr. Kimberly Okweze, and I'm going to be talking about tuberculosis. I'm a healthcare provider on this topic. So this is just a table of content. We're going to talk about the background of tuberculosis, transmission, signs and symptoms, diagnosis, high-risk groups, prevention strategies, and case management. Just a background on tuberculosis. So in the US in 2018, there were a total of about 9,000 cases of new TB cases in the United States, with an incidence of 2.8 per 100,000 persons. So in general, the prevalence of tuberculosis in the US is less than how it is globally. So worldwide in 2017, an estimated 10 million incident TB cases and 1.6 million TB deaths occurred. So TB in general is more prevalent in Southeast Asia and in Africa. Worldwide, TB is leading cause of death from a single infectious disease agent and the leading cause of death among persons living with HIV. So tuberculosis, even if it's now well controlled in the US, worldwide it is still a problem. So it is caused by the bacterium Mycobacterium tuberculosis. It primarily affects the lungs, but it can affect other organs as well. So it can affect the kidney, the brain, the spine, the liver. It can spread around outside the lungs. So not everyone with TB is symptomatic. People with TB fall into the category of latent or active TB. So people with latent TB have the bacteria, they're infected with the bacteria. However, they are not actively sick and they're not contagious, so they can't spread the infection to other people. The risk with latent TB though is that it can turn into active TB. So there's a 15% lifetime risk of someone with latent TB getting active tuberculosis. So on transmission, tuberculosis is spread through the air via droplet transmission. So it can be spread by an individual when the person coughs or sneezes. So people in close proximity can inhale the air droplets and then get infected by the disease. So, and then from the lungs, it can possibly spread to other parts of the body, like I mentioned previously. So if you have the bacteria residing in your throat and in your lungs, you're more likely to be infectious than other parts of the body. So some of the signs and symptoms. So the first and most common symptom that is seen is coughing. So sometimes this cough can be accompanied by blood or mucus. You can also have unintentional weight loss. They usually have fever and or chills. Sometimes they can have chest pain, and the chest pain can be with the coughing or even with breathing. So it can be pleuritic in nature. And they can have night sweats, which is when you wake up from sleep and you're drenched in sweat. Some of the other signs and symptoms are weakness, you can have fatigue, and you can have loss of appetite. So looking at the complications, some of the complications of tuberculosis are lung scarring, you can have spinal pain, joint damage, you can have meningitis, liver or kidney problems, you can have heart problems, and death is another complication. So a lot of these complications stem from the bacteria actually spreading to those areas. Another complication is someone who has had tuberculosis, who has been treated for the disease, can get tuberculosis again. And usually in those cases, it's harder to treat, especially if it's resistant to some of the common treatments that we use. To diagnose tuberculosis, the first step is having taking a good history and physical exam. So we can check the lymph nodes to see if there's any swelling in any of the lymph nodes, and we can do a good lung exam. So that includes listening to the lungs for any sounds that may give an idea of what is going on, and also just to see if there's any pain with chest pain with taking deep breaths. Another thing we can do is the PPD tuberculin skin test. So usually this test is very common in healthcare providers or those who work in the healthcare setting and those who are in facilities. So what happens is that you insert the antigen of the bacteria into the skin, and the person has to come back in 48 to 72 hours to check to see if it's a positive result. So the issue with this is that you have a high false positive rate, and you can have a false positive with the BCG vaccine. And the BCG vaccine is the vaccine used to prevent tuberculosis. Another thing you can do is the blood test, and that's the interferon gamma release assay, or IGRAs. So usually the blood test, the benefits with it is that you don't have to come back to get a read like you have to do with the PPD test. So you just do the blood test and you check for the bacteria. Also, another thing is if you've had the BCG vaccine, this test is more suited for you than the PPD test. We can also do imaging. The most common is the chest x-ray, and this is just to check for any fibrosis or cavitation and anything that signals that this person is infected with tuberculosis. The gold standard, however, and the one that gives us a definite diagnosis is the sputum smear and culture. So we're checking for the acid-fast bacilli, and a positive culture confirms diagnosis. So usually having a positive result with PPD or blood test only tells you that you've been infected with the virus, but however, this has to be confirmed with imaging or with sputum smear and culture. So simply being infected with the virus just shows that you've been exposed to it. It doesn't show that you actually have the latent TB or the active TB. So some of the high risk groups are people with a weakened immune system, and it's important because you need your immune cells to be able to fight the bacteria. So that includes people with HIV/AIDS, cancer, elderly, babies, those on immunosuppressants, diabetes. And on topic of immunosuppressants, that can be people on chronic steroids, so like transplant patients, or even those with rheumatoid arthritis or Crohn's disease who have to take those kind of agents to help with their disease. Occupation is a risk factor, so if you're a healthcare worker or you work in a residential care facility. Those in endemic regions like such as Asia, Africa, and Caribbean islands. Poverty is also a risk factor because of the lack of medical care to diagnose and treat it. Substance abuse, because drug use, alcohol can weaken your immune system, and tobacco also increases the risk of getting tuberculosis. Your place of residence is also a risk factor. So if you live in a residential care facility or with family members who have the disease, that puts you at high risk. So looking at the trend between tuberculosis and HIV, so prior to year 2000, when there was a high increase in the prevalence of HIV, the prevalence of tuberculosis also increased. As you can see here, when people with HIV, prevalence of people with HIV, when HIV stabilized, their TB also stabilized. And this little downward trend, you can see the TB cases also decrease. So there's a high correlation between HIV and tuberculosis. Also here, when looking at the number of deaths, there's a downward trend. So people who are HIV negative are dying less because they are there's less morbidity associated with them than those who have HIV. Some of the prevention strategies we can have the TG vaccine, usually given to infants and those in endemic areas. It's not recommended in adulthood because then it's not effective. Treatment for those who have latent TB, avoiding contacts with those who have tuberculosis, and if you know you're at risk of having contacts, constant screening. Protecting others. So if you do have tuberculosis, have cough etiquette. So don't cough in your hand, cough in your shoulder, or cough in a tissue. Hand washing with soap and water, and wearing mask. So for our case management, looking at different approaches we have to control tuberculosis. So the first thing we can do is prevention of HIV, because having HIV increases your risk of getting tuberculosis by weakening your immune system. Other things we can do is identify those who have latent TB and treat them so that it doesn't progress to active TB. We can also maintain and strengthen the current TB control so that we don't have people getting the disease. Then for those who do have the disease, we do the quadruple therapy, which is isoniazid, rifampin, ethambutol, and pyrazinamide. And for those with drug-resistant TB, they usually have to take those medications for a prolonged period of time. And then other medications are added for that. So we should be able to identify those with drug-resistant TB and treat that as well. Some of these medication side effects are nausea, vomiting, fatigue, jaundice, loss of appetite, vision changes, hepatitis, and neuropathy. These are my references, and thank you for coming to this presentation.